The idea of the Clinical Immunology Society began in 1984 when a small group of immunologists conceptualized an academic society devoted to facilitating the acquisition of new knowledge to improve the diagnosis and therapy of immune diseases. They were committed to education and training in the translation of research advances into clinical practice. The tireless efforts of John Fahey, Noel Rose, and others came to fruition in October of 1986 with the charter meeting of the Clinical Immunology Society in Baltimore, Maryland. The first plenary session was chaired by Bob Good, and Tony Fauci presented insights into the immunopathogenesis of AIDS. Other speakers at that inaugural meeting included Max Cooper, Hugh McDevitt, Ed Engelman, Bill Hazeltine, Bob Gallo, and in an auspicious start to an illustrious career, an oral abstract was presented by none other than Kate Sullivan. To many of us, the CIS is more than a professional academic society. From the start, it has been a community of people committed to collaboration, monitoring, and sharing of knowledge. As our community grows, so did our influence in medicine at large. Over the past 40 years, 3 generations of clinical immunologists have been trained to advance the care of patients with primary immune deficiencies and build partnerships across borders and specialties. Each of us carries this rich tradition in our commitments to our specialty, to our patients, and to the next generation of clinical immunologists.
Beyond impacting each of us personally, CIS fosters education, research, and collaboration, bringing immunologists together to drive innovation and improve the care of our patients.
The Clinical Immunology Society gives voice to our field. It gives voice to innovators, it gives voice to caregivers, and provides connection amongst an extraordinary community of people making a difference.
CIS is my family, my support network, and regardless of how challenging a case can be, I know that when we work together, we're doing what's best for all of our patients.
I am Eli Haddad and I am proud to support the future of CIS. In 2025, we have partnered with the other IAPIDS immunology societies to incorporate IAPIDS, and we co-found the Journal of Human Immunology. This new journal is important because it strengthens the future of our field by publishing groundbreaking discoveries and emerging therapies. And the important thing is that the revenue that it will generate will help to support IAPID educational and programmatic initiatives. And that will ensure that we nurture the next generation of immunologists who will care for patients with inborn error of immunity. Our hope is that all those efforts will become fully self-sustaining and that it will provide invaluable training for generations to come. Thank you.
Hi, my name is Xiao Peng, and I have been working alongside many of our colleagues within a CIS task force to support future implementation of genomics-based newborn screening in the U.S. Together, we've developed a comprehensive list of IEI gene-disease relationships to be piloted through the Beacons program. We hope to learn much from this initiative about the opportunities and challenges of genomics-first screening for IEIs. To help shepherd this and related efforts forward, we've also established a new Genetics and Genomics Committee dedicated to building shared resources and infrastructure for these initiatives. We hope that these efforts will help reduce the diagnostic and therapeutic odysseys for many of our patients whom we care so deeply about.
It is my pleasure to announce the Investigators of CIS Innovation Grant Program. We have 2 exciting grants this year. The first is the Vicki Modell Award in collaboration with the Jeffrey Modell Foundation, which awards $50,000 to a 3rd or 4th year fellow to continue their research in an effort to build their career trajectory. The second, which is new this year, is an early career award in the amount of $100,000. This award will be announced this summer, and we're excited to have our members within the first 5 years of fellowship apply to help their career trajectory. The ideas for this award is to continue to support innovation and precision medicine for the patients that we serve.
Happy 40th anniversary, CIS. I'm Matthew Kahn. I'm an early career immunologist and researcher. My experience with CIS started in summer school, which is pretty common now for people in my phase of their career. It's such a wonderful experience getting the mentorship, the teaching, learning about ways to better take care of our patients. But I think a really exciting outcome has been making a peer group of friends, getting to follow their amazing careers, things that have led to fun collaborations. It's really an honor to be chosen as the first ever junior counselor for CIS. I'm really excited to advocate for our whole society, but especially for those in their early career phase, and to help grow our tent.
As we close, I would like to thank each and every one of you. Whether you work in academia, clinical care, industry, laboratory diagnostics, or patient advocacy organizations, please remember that together we are CIS. And together, our future certainly looks bright.